Alright, so we've just had a look at how anxiety disorders manifest in humans and how they're diagnosed. So let's move to looking at the neural basis of anxiety as well as how it's studied in the laboratory. So here are our introductory questions on this topic. So the first one is, what emotions are easiest to model in animals? So here we have A, fear, aggression or anxiety, B, happiness, trust or lust, C, sadness, guilt or hopelessness, and D, resentment, empathy or envy. Alright, so I'll just give you a moment to turn your clickers. Alright, looks like everyone has put A. So fear, aggression and anxiety. Yes. So these are the easiest of all the emotions to model in animals because they're observable. So you'll actually see some examples where you can see fear and anxiety in the animals. C, the sadness, guilt or hopelessness are the main diagnoses for depression. And we'll see that sadness, guilt and hopelessness are difficult to model in animals because they're less observable. Alright, so our next question is, which brain region is considered to be important for anxiety? We have A, orbital cortex, B, thalamus, C, periaqueductal gray, and D, amygdala. Alright, so everyone has gone with D, amygdala? Yes. So that's the structure we most often associate with anxiety and fear, but in fact the answer is that all are correct. So we're going to see the role these other regions, orbital cortex and periaqueductal gray, play in fear and anxiety in a moment. Alright, so to get us going, let's have a quick look at this video. Alright, so while you're watching, have a quick think about what is going on in this video. So does anyone want to tell us what's happening in these clips?
Cats are getting scared of cucumbers.
Yeah, so two questions. How do you know they're afraid and why are they afraid of the cucumber?
They kind of jump and they're startled.
Yeah, and then they run away?
Yeah.
And why are they afraid of cucumbers?
Is it because they look like snakes?
Yeah, so cats have innate fear of predators such as snakes. So the idea is the brain is quickly processing this situation because it's more important that they survive than they correctly evaluate the situation. Alright, enough of the cats. Alright, so that was an example of innate fear. So cats are born afraid of snakes. Here is a different kind of example. So this is an experiment conducted in the 1920s by Professor Watson, and what you can see is this little baby known as little Albert is being exposed to these different animals. So we just saw a rabbit, prior to that was a dog, here is a rat. And you can see that he likes these animals, or at least he's not afraid. So he is investigating the rat and he's not upset. And then the experimenters did something to little Albert called conditioning. So basically every time the white rat came into the scene, they would bang a really loud startling noise. And you can see what happens, they're about to do it in the video. He falls forward and then he starts to cry. So humans innately don't like loud noises. But every time the little rat comes in, they pair it with a noise. And now you can see that he has a different response to the animals than what we initially saw. So you'll see what happens when the dog gets too close to him. So there he goes, he starts to cry. So this video tells us two things about fear. Does anyone have any ideas about what they are?
That it's learnt.
Yes, so that's the first important
It can be learnt.
fear that the first important point is that he had no fear of these animals to begin with, but then once they were paired with this fearful stimulus, he started to show fear reactions to the animals. And what was the other main point?
That he was scared of all of the animals, not just the white rat.
Exactly. So fear is also generalizable. So the loud noise was only paired with the rat, but he had a fear of the dog as well. So this is an important basis of anxiety disorders, and that they can be learned and also generalizable. So they apply to a wider range of situations than those you've simply experienced. Alright, so here we have two examples of paradigms that are used in the laboratory to study anxiety. So the first one here is called the elevator plus maze. So basically there are two closed arms and two open arms. And you start by placing the rat in the center of the elevator plus maze. So which arms would you expect a rat to naturally run into or spend its time, basically?
The closed arms?
Yes. So rats are innately afraid of open spaces because it makes them vulnerable to predators. So a normal rat would run into the closed arm, but this rat is spending more time in the open arms, which means some experimental manipulation has occurred. So for example, if you injected an animal with benzodiazepines, which are the main treatment of anxiety disorders, they will spend more time in the open arms than the closed arms. In fact, this apparatus is used as a screening device. So any drug that changes behavior and causes more time in the open arms or decreases anxiety would then go on to be tested in humans. So this is in fact how ketamine was discovered as a viable treatment of depression. So ketamine as in the abused horse tranquilizer. So it's a dissociative anesthetic that may benefit people that suffer depression as well as other illnesses. And here we have a different paradigm. In this case, the rat has on previous occasions received noxious foot shocks through the floor, and then on a number of days, and then he goes into this box and he remembers that, and then he finds the situation scary. So how can you tell this rat is afraid?
Because it's pooped.
Okay, so there's poop under the floor as well as his freezing behavior. So this isn't just a still photo, he's actually resumed a posture that will aid him from avoiding detection from predators. So this is a learned example of fear, and this is an innate fear. Alright, so we're more restricted with the situations these days that we can use with humans. So for example, in the conditioned fear, we could inactivate or lesion the brain and then see what happens to the fear response. So we're going to touch back on this in a moment. But in humans, they're more likely to use brain scanning techniques. So for example, a human would lie in the PET scan and they'd be shown a series of faces. So neutral faces and fear faces or angry faces. And when they're in the PET scan, the glucose or oxygen or whatever radioactive dye that you've injected into the person will show that the amygdala is more active during the viewing of fear faces than during the neutral faces. So this means that the amygdala is responsible for processing fear in the environment. Alright, so let's put this all together. The amygdala is the central structure in the neural circuitry. We have the lateral and central divisions, and then we have a host of brain regions that provide input to the amygdala, and then the information is distributed across other brain regions to initiate the fear response. So for example, in the case of the cucumbers, the thalamus receives input very quickly from the eyes, and this is processed quickly, sent to the amygdala, and then to a region called the periaqueductal gray, which is responsible for the startle, the fleeing, and the freezing responses that we saw in the cats. So this is a so-called low road, very fast, very crude, get the animal out of there for maximum chance of survival. It's the orbital cortex here that is responsible for suppressing this fear reaction. So the cortex, with more time, can fully evaluate the situation. So if the cat had more time, it would realize that this was in fact a cucumber and not a snake, and then the fear in the amygdala would be inhibited, and then the fear response would be reduced. We also have a number of regions here downstream of the amygdala. So if we use the conditioned fear response as an example, so for example, if we lesion the periaqueductal gray, which I told you is responsible for freezing, then the animal would no longer show that aspect of the fear response, so it would be freely moving around. However, it would still have a cardiovascular response. So you know when you're afraid, your heart and your blood pressure increase. increase. It's the hypothalamus that's responsible for this part of the fear reaction. So if your periaqueductal grey is lesioned, you don't show the overt freezing, but your heart rate and blood pressure would still increase. And likewise vice versa. If you lesion the hypothalamus, then you won't have the cardiovascular response, but the animal would be still freezing. Alright, so that was the summary of the neurocircuitry of fear. Do we have any questions?